Bladder cancer is a malignancy of the lining of the bladder. Often it is a superficial disease, so it's just on the lining of the bladder, which is the most common type in about 80% of bladder cancers. But in a further 20%, then they have the ability to invade through into the deeper muscle layers of the bladder, and that's a much more serious type of bladder cancer and needs to be treated much more radically. One of the problems with bladder cancer, and particularly the more aggressive types, is that they don't declare themselves early, and that's often a problem. With any cancer, if you can catch it at an early stage, then the chance of completely removing it are much higher. The early signs of bladder cancer, the most common, is blood in the urine, and that can either be on a trace of blood in the urine on a test that your doctor or nurse would do, or it can be visible signs of blood in the urine. So there is a mantra in for all doctors that we learn at medical school to say blood in the urine is bladder cancer until proven otherwise. So anyone that has any blood in the urine needs to go and tell their GP or come and find specialists like me in secondary care, and we need to do some specialist tests to have a look at the bladder and exclude bladder cancer. So bladder cancer, as I said, is 80% is on the lining of the bladder, and an operation which removes that and shaves that away on the inside of the bladder, done endoscopically with a camera inside the bladder under a general anesthetic, is quite often all that is needed to completely remove that cancer. For cancers that have the ability to invade through the muscle, if caught early enough, yes, are completely curable. What makes cancer not curable is when the cancer fractures away from where it starts and spreads to other parts of the body, and that's then you start chasing your tail. So it comes back to the point where, yes, if you catch a cancer early enough and you remove it, or you treat it with radiotherapy or with other forms of cancer treatments, then yes, it's very curable, but it depends on when you catch it. All cancers can be staged according to their level of invasion, and there's a kind of standard 4 stages. Stage 1 of bladder cancer is just when it's on the lining of the bladder. Stage 2 is when it's invading into the muscle of the bladder. Stage 3 is when it's invading through the muscle and into the fat on the outside of the bladder. And stage 4 is when it's gone right the way through and is invading into other organs adjacent to the bladder. Now, clearly, if we're managing cancer at stage 1, then that's very curable and very manageable. Stage 2 is, again, with more radical treatment, is much more curable. But when you start getting into stage 3 and stage 4, the chances of cure do drop down, but there's still surgical procedures and cancer treatments which can be very effective. But as I said, the earlier we can catch them, the lower the stage, then the best chance of treatment. The survival rate of bladder cancer is relative to the stage. So as I said, if you've got stage 1 disease, then the survival rate is excellent and close to 100%. And stage 2 disease, it depends on how it is treated, whether it's surgery or radiotherapy. A common quoted statistic for having muscle invasive disease and having an operation to remove the bladder and the cancer is quoted at about 80%, and that can be further improved potentially with depending on the exact stage within that, and also with additional potential chemotherapy treatments and immunotherapy treatments.